Plague Medication Dispensing Site. This clinic is operating in response to a public health emergency. If you or another person in line near you needs an interpreter, please use the language ID card to show staff what language you speak or read. Plague. Yersinia, Pestis. The following information will help you prepare to receive medicine from the professionals here who are involved in this response to incidents of plague. Plague is a serious health threat that is very contagious. Plague can be infectious to humans and animals. Plague spreads through breathing, coughing, sneezing. If you have symptoms or are sick, please leave this site and go to a hospital or treatment center now. If you already have symptoms of plague, you should leave here and immediately go to a hospital or treatment center for evaluation and the appropriate treatment. Look or listen for instructions on how to get to the nearest hospital or treatment center. Plague symptoms include high fever, headache, weakness, rapidly developing pneumonia, shortness of breath, chest pain, cough that may bring up blood. If you already have symptoms of plague, you should leave here and immediately go to a hospital or treatment center for evaluation and the appropriate treatment. Look or listen for instructions on how to get to the nearest hospital or treatment center. Plague can be successfully prevented with the medicine you will receive today. If someone is exposed to the bacteria but not yet sick, antibiotics may be given within 7 days of exposure to prevent the disease from developing. Early medication is essential to prevent further infection and possible death. If you feel you have been exposed to plague, but you are not sick with plague symptoms, please stay here. Those who have been exposed to plague may avoid becoming sick if medicated right away. Those receiving medicine today should follow all the instructions that are given carefully. You may be able to pick up medications for everyone in your household. Pay close attention to the forms you complete. You may only be given enough medication to start therapy. Remember to ask how, where, or who to contact to refill the prescription. The following items are helpful in processing you and your family to receive the medications available here today. Although not required, please have available driver's license or ID, list of all medications or supplements you are currently taking, both prescription and over-the-counter. List of medical conditions and allergies. The items on the list are not required to receive medicine. If you do not have these items, stay here anyway. We want you to receive medicine today. The medicines and services you receive at this dispensing site do not require any payment from you. The medications are provided from the government. The medicines and services you receive at this dispensing site do not require any payment from you. The medications are provided from the government. The service is free from your state or local health department. The people working in this clinic may be staff from your local health department or volunteers from your community. Please be patient with everyone as we serve your community during this event. The Strategic National Stockpile medications for the prevention and treatment of plague are CIPROFLOXCIN, DOXYCYCLINE. If you are allergic to these medications, please advise clinic staff before you are dispensed medications. If you are pregnant, planning to become pregnant, or nursing, advise clinical staff before you are dispensed medication. We appreciate your cooperation and patience as we provide the medicines and manpower to respond to this emergency situation. Everything that can be done by the medical and support staff of this response is being done in the interest of public health and safety. Maintaining a high quality of public health is our job, and it is a job in which we take great pride. If you would like to review this material at a later date, ask a staff member where you may find it on the web, or look on the information you are given. A web address may be included on those. Most public libraries have computers and internet access free to the public. Where to get more information. Stay tuned to local media for ongoing updates. Centers for Disease Control and Prevention Public Response Hotline. For English, 888-246-2675. For Spanish, 888-246-2857. TTY users, 888-874-2646. Texas Department of State Health Services website, www.dshs.state.tx.us. Centers for Disease Control and Prevention website, www.cdc.gov. Please stay here while this video is repeated for anyone who has not had a chance to see it. And once again, thank you for your patience and understanding.